Good morning and welcome to the COVID-19 Emergency Response LDI Huddle Call for September 10th, 2021. So again, we continue to be knee-deep in the pandemic and appreciate all the sacrifice that we're seeing across the organization and all the grit and all the resilience. So without further delay, we'll get right into our key statistics, which shimmer a gleam of hope this morning. Karen?
Good morning. So our 14-day positivity is 21.3, 7-day is 21.6, and that has really stayed steady for a while now. So that's good that it's not going up. Our 7-day average is 135 patients per day that we're seeing COVID positive, and our 7-day projected census is now 160. Inpatients, we had 161 total COVID positive patients. 115 of those are in full isolation. 46, the isolation has been removed. At Berkeley Hospital, we have 15 patients that are COVID positive. All of them are in full isolation. They have 5 in their ICU, 2 on ventilators, and 6 ER holds. Mount Pleasant has 40 patients, 33 in full COVID isolation, 7 the isolation has been removed, 5 in ICU, 5 on ventilators, and 3 ER holds. Roper has a total of 60 patients, 32 that are in full COVID isolation, 28, the isolation has been removed, 14 in ICU, and 10 on ventilators and 4 ER holds. St. Francis has 46 patients, 35 in full isolation, 11 the isolation has been removed, 9 in ICU, 4 on ventilators, and 12 ER holds. We're still seeing about the same. Our total inpatients who are not vaccinated is 85%. But our ICU patients not vaccinated is now 97%, and on the ventilator is now 95% of our patients are not vaccinated. Home care has a total of 53 patients, 48 in home health, 4 in home hospice, 1 in the hospice cottage, and 44 pending admissions. Thank you.
All right, thanks, Karen. Moving on to operations for teammate health, I'm going to give the report of just the numbers. Currently, we have 107 teammates out. 49 of those are RN job titles. We have 68 positives, and we have 39 that are pending test results. We returned 18 back to work yesterday. 2 of those were RN job titles. So moving on to Doug Bryan for our first dose vaccine clinic update and the vaccine mandate progress update.
We provided 34 first doses in our 3 clinics this week. We've got 4 first dose clinics next week: Monday, St. Francis; Tuesday, Berkeley; Wednesday, Roper; Thursday, Berkeley, all 7 a.m. to noon. First come, first serve, no appointment needed. Please help us get the word out about those. And then in terms of vaccine exemptions, our deadline is September 17th. We have not received that many so far, and just want to make sure all leaders work with their teammates as applicable to emphasize that September 17th deadline and get the forms submitted. That's it. Thank you.
All right. Thanks, Doug. Moving on to acute care operations, Dr. Segan.
Yeah, good morning. I have 3 brief updates this morning. First of all, we are going to take yet another look at our COVID cohort strategies today and see if there's any opportunities to optimize that strategy to allow us to decompress the ED, so more to come there. Second of all, we are, in the last 24 hours, I have worked with the intensivist, the pulmonologist, the hospitalist, and respiratory therapy, as well as we'll be working with nursing to formalize some new oxygen conservation strategies, specifically looking at the use of high flow and BiPAP. And then finally, the third thing is that we are working closely, or we've always worked closely, but we're working even more closely now with the palliative care team to tighten our alignment with them and get them working aggressively on all the COVID patients to make sure that we are doing all we can for those patients and in supporting them in all their needs. And that's all I have to report this morning.
Thanks, Dr. Segan. Matt Desmond, any update on the surgical schedule pause?
Yeah, thanks, Dr. McLean. We've been working in collaboration with physician leaders, nursing, and peri-op, and we have made a joint decision to extend our current perioperative scheduling policy. Is slowing all of our, or ceasing all non-emergent and urgent inpatient cases. So that is going to extend out to Wednesday, September 22nd. And that timeline should allow us to onboard the high number of rapid travelers. And we'll be working with, we already have pushing out communications to the surgeon offices via Kevin yesterday. And we'll be working with Andy and team to push out communication to teammates today. Thank you.
Thanks, Matt. Moving on to a nursing update, Risa.
Yeah, good morning. Just to reiterate what Matt said about the rapid hires, we did engage with a second contract agency company last week so that we could more rapidly bring in a higher number of nurses in a shorter period of time. We are making some ground through our right sourcing asks. They're about 75% delivery of what we asked for the rapid hires. And we have 24 more of those nurses coming in next week. ProLink, who is our new partner that's doing a focused hire for us, we're working with them daily to work through those lists and making sure that we're pointing the nurses as they come in, and respiratory therapists. Happy to say we've gotten 4 so far, to bring the team's relief in the spaces that it's most needed. We are updating those managers directly and directors, which I think is a better process as we try to move through the daily pivot of where people are needed the most. I have Andrea on the phone to talk about the retired nurses. No real updates on the labor pool, just continued thanks for people that are doing it, especially the off shifts and weekends where teams are saying they also need support. Andrea?
Hi, good morning. Just wanted to share with the group that we're engaging in other efforts outside of travel labor to bring in some support. And 3 key efforts include a contact with retired RNs who left our system within the last 2 years as retirees. And we have 5 returning right now and hoping to bring back more, and those folks can work as task RNs and support of our staff. We are also working with South Carolina Hospital Association on an outreach they did to license nurses to rapidly hire. We have about 6 of those in the process to bring on. And then the South Carolina DHEC Corps volunteers, working with them for volunteer type roles and deploying those where level of competence is most appropriate. So additional work happening to provide relief where we can. Thank you.
Thanks so much, Andrea, for all that hard work that you're doing there. I know it's helped. Moving on to emergency department operations, Marcella.
Good morning. The EDs continue to be busy, seeing about 125 to 130% of budgeted volumes. We continue to run into a lot of boarding issues and a lot of LWATs as a result of that. But presently, we're boarding 29 COVID positive patients in the EDs across the system and 1 COVID negative patient.
All right. Thanks, Marcella. Patrick Bossy, any update on the Berkeley swabbing site? Patrick? All right, well, I'll give a short update. They are looking to go live with a 1 to 4 soft trial today to kind of see how that goes, setting up basically some alternative testing availability, try to decompress the Berkeley ED, where we see an exceptional amount of folks coming into the ED just for testing. Looking to set that up from Monday, Tuesday, Wednesday from 9 to 4 next week, if that goes well. Appreciate Charleston Fire Department for assisting us with the tenting and the generators and the air conditioning to make that a little more accommodating for the folks out there working hard to get everybody maintain the safety in our community. So appreciate all the hard work there. Moving on to physician partners operations, Kathy and Bob.
Hey, good morning. This is Kathy. Our express care volume continues to be high. We'd like to recognize our providers and practice managers for their support of what we called our all hands on deck staffing strategy that we put in place last week. With that, we have adequate staffing now to maintain these large volumes. I want to add to Chris's comment about a little glimmer of hope. So